Hi guys, my name is Sierra and welcome to my channel, or welcome back to my channel. I am currently a first year nursing student and I am in my second term of nursing school. It's almost over, which is absolutely crazy. Before I get started, I just want to apologize for being MIA. I've just been so busy with school. Right now I'm taking 3 classes: pharmacology, pathophysiology, and chronic illness. And then I have clinical on top of that, and it's just been very time consuming. And obviously my schooling has to come first. I promise I will start sharing more with you guys. I just needed a minute to take a breath because I've just been so overwhelmed with school and all of my assignments. It's just been a lot, but that is not what this video is about. I will talk more about how I'm feeling about school in another video. Today I wanted to share with you guys about what is in my clinical bag. Ta-da! It's a big bag. So right now I'm doing clinicals in person, and for me they are 10 hours long. So I spend half the day at the hospital, and I've been spending my time on the medical floor or the surgical floor. And then we have lunch, and then I spend the other half of the day on my school campus, and that is where we do skills, simulation, lab. It's where we practice things at school to get checked off for them prior to actually performing the skill in the hospital. I'm on week 8 right now, so I've been 8 weeks into the hospital and it's been absolutely awesome. I just wanted to show you guys what's in my bag and kind of share that with you, and I always really liked watching these videos. I'll preface this with that I don't bring this whole bag into the hospital with me. I only bring a couple items, but I bring this whole bag with me onto my school campus when I am doing my clinical on campus. So this is my clinical bag. I know people have really cute bags that they order online. This bag was given to me and my whole cohort from our school, and it works totally fine. I haven't felt the need to go buy a new bag. I'm sure when I'm graduated from nursing school, I will purchase a bag that I will then use to take into the hospital, because I probably won't want to carry this big old thing around. But for now, this bag works, and this is my clinical bag. First things first, I have a side pocket. I always take my water bottle with me. I bring this into the hospital with me and then sanitize it down after I leave the hospital. And then I always have this at school. Water bottle, priority, people. And then I'll go into the other side pocket. Let's see. Oh, yeah. These are glasses that are kind of dirty. I haven't really worn these. I'm not really wearing these right now. We are wearing face shields, if anything, and our masks, but not really these glasses. So I've been leaving them in here, but I don't think I've worn them this term. I think I wore them last term, mostly. Now we will enter the front pocket. This is where the exciting stuff happens. I have my name tag. So this is my badge to get into the hospital, to get onto the computer system. What else is on here? Emergency code information, how to use the fire extinguisher. This is so people can acknowledge that we're first year students in the hospital, because obviously we do clinicals at a teaching hospital, and there's first year students there and there's second year students. And as students, we are in different places, obviously. So what a first year student can do is obviously very different than what a second year student can do. More fall risk. I've really never really looked at this stuff. And then our competencies, this is for our homework assignments. This is my name tag. I keep it in here so I don't lose it, and I just clip it onto my scrubs whenever I have clinical. Next, in the front pocket, I have gum. Oh, this is kind of a mess. I really didn't like go through this. This is real, oh gosh. I have my watch. I put this on for clinical as well, so I just leave it in here so I don't misplace it or lose it, because that happens quite often. Then I have this in here. This is when we were learning our head to toe assessment, and this is like a little laminated sheet that was given to us by one of our instructors, and it just kind of hits all the key points for your head to toe. It's really very helpful. For example, it will say neuro, orientation, perla, right and left, motor sensory function, verbal response, things like that. So I don't really use this anymore because I have it all pretty much memorized, but this was very helpful, and I'm just keeping it in here just in case. I have a lot of pens and pencils and Sharpies. What else is in here? Oh, this is my pen light. I put this in my scrubs as well when I'm doing my head to toe assessments on my patients. So I keep it in here so I don't lose it again. Germex that was given to us by my school. I have chapstick. I have my headphones in here. These are helpful. A protein bar. This has been in there for a very long time. And I pack a lunch separately, but I keep this in here just in case I'm getting hangry. This is a tampon, just in case. And then I have some sticky notes. So that's everything in my front pocket. It's a mess in there, but it has all the goods that I need. Now we will get to the really interesting stuff. So, I'm gonna open this up. First thing is my stethoscope case. I don't bring this whole case into the hospital. In fact, I have several things in here that I don't use at the hospital and I haven't even used. So I have bandage scissors in the front pocket. And then I have a pulse oximeter. I don't bring this into the hospital. The only thing I bring is my stethoscope. I usually just put this in a pocket or put it around, put it around my neck like that. The reason I only bring my stethoscope in is because in the hospital they have, I forget what they're called. I don't think they're called tripods or carts, but they're like little moving carts that you take into each patient's room. Of course, you wash it down after each room. But attached to it has a blood pressure cuff, a pulse oximeter, a thermometer, things like that, so you can take vitals at once, and it's hooked up to a machine so it like automatically puts it into the system. So I just bring this so I can listen to heart and lung sounds. I don't need the other stuff at the moment. And the rest of the bag, so this this is a bag that I was given in clinical on my campus. I've just been bringing it in case I need it for any reason, but this has PPE in it. This is for when we were doing community clinicals. So sometimes we will do clinicals that are out in the community, like shadowing a home health hospice nurse or just a home health nurse, or working at the outpatient cancer center. There's like a variety of different things everybody's been doing. And so this was PPE for that. So, I don't know, ooh, well, it's not very clean anymore. But these are super cute PPE gowns that you put on and off. And you learn the proper technique for putting them on and taking them off in school. So I have those, and then, oh my goodness, I always have a lot of masks in here. And then several pairs of gloves. I got that because I shadowed a home health nurse, and we use PPE when we go into specific people's homes, just with everything that's going on. So next in here, I have my Mosby's drug guide. This is because I've been working on my pharmacology projects at school, or else I probably wouldn't bring this. Well, that's not necessarily true. When we're in the hospital giving medication administration, it is our responsibility to inform the patient of the medication that they're receiving, the purpose for it, the side effects, all of that sort of information if they want. And a lot of times, maybe they know what they are, but sometimes they have questions, and we have to write all of that down prior to administering the medication. And so I'll research on the computer at the hospital, or we have an app on our phone that has a drug guide. But I guess you could bring this into the hospital too. It's just kind of bulky. But anyways, I've been bringing this to school because I'm working on my pharmacology projects that are due at the end of the term. Lord help me, because I still have so much to do. So yeah, this is our drug guide book. It's really interesting, handy dandy. What's next? Oh, next is another item that I bring into the hospital. I got this clipboard because my brother actually recommended getting a clipboard. Personally, I would rather have a clipboard that folds up into a square, just because sometimes this is kind of frustrating to have everywhere and finding a place to set it down, especially when you're in a patient's room and you're maybe performing a skill. So it would be nice to have something that I can fold up and put in my scrub pocket. But for now, this is working. So in this, I have, oh my goodness, I always bring this in just in case. I have more masks that haven't been used. This is my school's little policy of staying at home if you're experiencing any of these symptoms. And then on top, I'm not really gonna show you guys these papers because it has some stuff on them, but I mentioned in earlier videos how every week in clinical we have to do this intense project. It's a patient care plan, and basically we pick a patient in the hospital and we have to perform a full head to toe assessment, and we gather all of that information from them and from their charts. We do our pathophysiology on the reason that they got admitted into the hospital. We do our Tanner's reflections, we do our competencies. It's a project that can take anywhere from 8 to 11 hours, and that's every single week. And that's not my 3 classes, that's just a clinical assignment. So very, very fun. But it is really productive in learning, and it is very helpful. So anyways, it's like a 15-page document, and once you finish with it, it turns into a 20-page document. And there's a lot of information that you're not doing at the hospital, you're interpreting that and you're doing it at home. And so I made kind of like a cheat sheet, and it's 2 pieces of paper that have the quick things that I need to know and remember to write down, like 6 of the medications that the patient's taking. So then I'm gonna take those home and write down the interactions, the side effects, the purposes. I'm writing down their lab values, urinalysis, all that good stuff. So I print off new sheets of these every week and take them to clinical. Next in here, oh yes, this is awesome. I recently got checked off for doing a Foley catheter in clinical on campus, which means that I'll be able to do it in the hospital. I should not have this in here. This is our skills sheet that I meant to put in my folder at school, and this is when you get them done on campus. Have an instructor sign them and check them off for you, and you're able to do them at the hospital. But I'm not supposed to have this with me, so I need to take it back. This is my volunteer hours sheet. We're supposed to be volunteering 10 hours a term in my program. And then this is just some other handouts that I was given in clinical. So this is the Braden scale for predicting pressure sore risk. I have Foley catheter insertion. This is just the whole skill and process of going over it. That's something for the hospital. And then this is my little notebook that I bring into the hospital. And this is like my clinical notebook. So I just take notes, things that we learn from instructors, sometimes things that I write from the hospital. Yeah, and so all of that fits in here, and I just bring that with me to campus and to the hospital. I have a little pencil pouch. I think I have like a ponytail in here, some flashcards, more pens, pencils, chapstick. Nothing super interesting. And then I have another pack of flashcards. I also have my wallet in here. And then this is my planner where I write down times that tests are, clinical days, assignment due dates, and things like that. And then this, oh my gosh, I haven't even opened this yet. This was, well, here, let me see. This is a Foley catheter kit, and this was for us to take home and practice. However, I didn't actually practice it at home. It's kind of hard to practice the whole skill at home because you kind of need a person or a mannequin. Although somebody in my clinical group got very creative, and I think she used a water bottle. I don't know, good for her, kudos. I practiced this a lot at school, and then I got checked off on it recently, so I don't really, I mean, I can show you guys what's in it actually. Inserting a Foley catheter, this is basically something you insert in somebody's urethra because they're having trouble peeing or for kind of various different reasons, but this is a skill that is sterile, meaning you have to use sterile technique on top of it, which makes the skill a little bit more complicated, at least for me right now, because I haven't learned a whole lot of things. And this was our more complicated skill this term. And so you open this up. I'm gonna show you guys. You would throw this away. I don't know, I would throw that away. So as you're opening it up, you're opening it up away from you. Sterile, now you have a sterile field, except for, I think it's 1 to 2 inches from the border of this opening paper. And then in here you have sterile gloves. There's specific ways you have to open all of this. There's a lot of videos on YouTube that were really helpful to show me how to do this, and you have to put these on a specific way too. So those are my sterile gloves. And then I don't know the names for these, but you put this piece of paper, cloth, fabric, I don't know, shiny side down. This goes between the person's legs. And then you can put this to help you too, so you can focus on where you are inserting the catheter. And then, oh, this is lubrication to help insert the catheter. And then soap towelettes that you use to clean the person before inserting it. And then this is water, and this is to blow up the balloon in the catheter so it stays in the person. And I think this is if you're doing a urinary analysis. We didn't really talk much about this, but I haven't used this, and you would write down all the information and then take it to the lab. And then this is the urinary catheter. So exciting. So I'll just undo this for you guys. So this is the catheter itself. This is what would go on somebody, and you would blow up this balloon. This would blow up because you would take the cap off of this, hook this up to here, and then insert it into them, and then hang this on their bedside. Urine would drain from the catheter into this bag, and then you could measure input and output as well. So yeah, really cool stuff. So that is that. And then I just have 2 more things in here. So I have my laptop. I bring this to school campus. I don't use it all the time. Sometimes we have downtime and I'll start working on my clinical judgment worksheet, or sorry, my care plan that I told you that we do for a patient in the hospital. I'll get started on that as quickly as I can so I can try to have some time on the weekends. So I'll bring my computer with me, and sometimes my clinical group and I will watch videos on YouTube based on our pathophysiology chapters, because those are very hefty. They're very time consuming and it's a lot of information. It's been quite a lot this term. And the last thing I have in here is my clinical textbook. So this has all of our skills that we were learning. So it's nice to have this there. I know some people have this on their phone and download it, and so they can just pull it up on their phone, but I like hard copy books. And so it's nice when we're learning a new skill to just pull it up step by step, have it right in front of us if we didn't print it off prior. It's called Clinical Nursing Skills Techniques, Perry and Potter. We got tested on a lot of questions based from this book. And that, my friends, is everything in my clinical bag. I hope that was interesting to you. I just want to say thank you guys so much for watching. Thank you for the support. I have 1,500 subscribers on here. I cannot believe that. I hope you guys are all doing really well. I know it's already almost March, which is absolutely crazy. I don't know where this year is going. And if you're in school right now, don't procrastinate, stay on top of your work. I hope that's going well for you. Again, just thank you so much for watching. Thank you for the support and the kind words. I hope you guys are having a great morning, afternoon, evening, whatever time it is, wherever you are right now. And I promise I will see you guys again very, very soon. Bye.